Left Wing Kings. Listen, think, act, repeat. Welcome to the Left Wing King podcast. Today we're diving into America's displeasure with the U.S. healthcare system. I am your HMIC, your head moderator in charge, Malik, and I'm joined today by King Ace.
What up? What up?
King Steve.
What's going on?
And Queen Tina on the comments. So let's go ahead, break down how this show works for you people out there, all right? So I'm going to go over all of our topics, and once we're done, we're going to circle back and respond to some of your comments and questions in the live stream chats from Facebook and from YouTube. Then we'll take a few phone calls, but I won't be sharing the calling number until we're ready to start taking those calls. You got it? Let's get it cracking. On Wednesday, December 4th, 2024, United Healthcare CEO Brian Thompson was gunned down in Midtown Manhattan. This tragic killing was or has sparked conversations around several problems with our healthcare system, which might have motivated the gunman. Now, before we begin to address these problems, we want to say that we in no way support the killing of any employee, regardless of how one might feel about the company or the industry that they work for. So let's get it cracking with reason number one, that Americans are unhappy with our healthcare system, and that is high cost. So the U.S. spends more on healthcare than any other country, yet many Americans struggle to afford medical care. High premiums, deductibles, and out-of-pocket expenses leave many in financial distress. Ace, why do Americans pay so much more than other countries, and what can we do to solve this problem?
Yeah, I mean, you know, that's capitalism at its best, man. I mean, the healthcare is a for-profit business, you know, and when I started studying up on this, United Healthcare is actually fourth on the Fortune 500 list. You know what I'm saying? I mean, think about that. That's healthcare. Healthcare insurance, definitely, but they're fourth on the Fortune 500 list. They're better than Google. You know what I'm saying?
Crazy.
They're better than Exxon Mobil.
Damn.
You know what I'm saying? With that being said, businesses can control cost. You know, a business that profits. Wow. They do what they need to do to profit, you know, minimum services, but they increase the price on you, you know, and that's kind of the detriment of the healthcare system in the United States. They don't operate to I mean, I'm not going to say that completely, but they're in it to make money when they should probably be a little bit more leaning towards making sure that we're taken care of and we're healthy. And sometimes those choices come to the cost of people's lives. You know, they're denying them whatever because they have a profit model. Luigi Mannioni went in there and pretty much, you know, even on his bullets, he was saying that he wrote down the principles of the insurance industry. You know, those principles being, you know, deny. I got him here. What I write?
Delay,
and dispose. That's just crazy because we pay insurance straight up. You know what I'm saying? It ain't like, you know, they got our money. You know what I'm saying? And their principles is to deny. They have a practice where they deny, delay, and dispose. And that's kind of that you know, that kind of drew that. But end of the day, in the end of the story, we pay, you know, it's a lot of reasons that we definitely pay higher. We pay it because of our administration inefficiency. Insurance companies and a lot of things we have to deal with administrative wise, and just basically pharmaceutical companies, things of that nature. They're in it to profit.
Yeah.
And that falls back to our system of economics, which is capitalism. I'm a capitalist. I'm not talking bad against capitalism, but that's just the realistic approach. You have our medical industry. It's like any other business. They're in it to make a profit. Right. And when you do that, you put out, you try to make, you know, you put out as little as you can and make as much money as you can on it. You know, you try to control your overhead is basically what it is. And same thing in the medical business.
Yeah, I'd agree with that. And it's not just the insurance companies, it's the hospitals, it's the pharmaceutical companies as well. And like you said, it is a thing with capitalism. And sometimes what people have to realize, some things don't need to fall under that. Some things need to be socialized. Just like, you know, we have a public school system. We should have some type of public health system so people can go to the doctor and it be affordable and everybody has an opportunity to get well. Because what ends up happening is when you have things that are that expensive, that rolls over into more people getting sick. If you have any type of pandemic or anything like that, you're going to have more people getting sick, even basic shit like the flu.
Right.
If you have people who aren't going to get that taken care of, and maybe they might not be old, but they might be middle-aged like us, okay? And then you get the flu, you get pneumonia or something like that within, you know, it's more deadly, it costs more money.
Right.
Okay. And what we as a country need to really look at is we are middle-aged. We as a country, we need to look at what is going to be best for us and not look at the labels of what it is, you know, because I feel like all the health insurance companies and hospitals have to do is say, oh, well, you don't want socialism. And that scares everybody. You know, and it is. It's because they have frightened people into being afraid that they're not going to get what they need, and they end up paying more money and not getting what they need anyway, and pay more money not to get it.
Yeah.
And when you're speaking on hospitals, real quick, when you're speaking on hospitals, something else I found out in my research, the healthcare industry, and in fact, the hospitals are one of the industries that can consolidate power. It's like we say, Baptist, they can a Baptist, university or whatever. They got a monopoly. You know what I'm saying? They, you know, they can. The healthcare industry can have a clinic. They can have a hospital. They can have a renal care. They can have an ER, and they get to monopolize that. And with that, they get to control costs. And what the hospitals get to do is they get to, you know, play back man. They used to get to give the cost, and they'll throw it on the insurance company. When you complain, hey, that's your insurance company. Doing this and that. When end of the day in the story, it's also like you said, the hospitals, they're actually controlling the costs. That are throwing out the prices. You know, it's a lot of things like new technology to come into play with that, but still.
So a few things, man, that I heard, and I want to kind of make sure that we address this other part of the question too. Is like, why do we pay more to other countries? Like, I understand capitalism. Right. The companies are based in the United States, so they have to, they're the capitalistic, I guess, environment that they live in. So they have to be that way. But these companies also exist outside of the United States, right? And they provide coverage in other places too, some of them, right? Like pharmaceutical companies and things like that. They're giving drugs. They're not only selling their drugs here, they're selling their drugs in other places in other countries. So, you know, but our cost for the same drug here is 3, 4, 5 times more than another country. Like what like they're, to me, when I think about it, I think they're taking advantage of the prosperity of the United States, whereas a third world country that may not be as developed, well, you can get it for 5 cents.
I can answer that for you.
You know, okay, help me out with that.
Okay, so most countries, as far as drug prices and everything, they have some type of regulation. Okay, pharmaceutical companies usually use America as A, the guinea pig, and B, they kind of use it as their breadbasket. They know, these pharmaceutical companies are aware that they're going to be able to make the bulk of their money in the United States because the rest of the world is not going to be okay with paying for that. Okay. And that has been something that has been going on most of my adult life.
So how can we become okay with that? Like the other countries, like you said, United States, other countries aren't going to be okay with that because of the regulation. I guess what I'm saying is, why don't we make regulations that do the same thing in our own country?
Because
we're not okay with that shit either.
Well, I mean, it's the politics. You know, Biden capped, insulin. You know what I'm saying? And I think they were working on battling the pharmaceutical companies.
That's a great point.
You know
like that's one thing.
And I'm saying that's one thing.
Type of medicine.
Yeah, I'm saying, but coming to this, it's the lobby. It's the lobbying of Congress. Pharmaceutical companies got a big lobby in Congress. So unfortunately, there's some Congress people that, they make rich and put money in their pocket. You know what I'm saying? And so in turn, they allow them to rake us over the coals when it comes to pharmaceutical charges. You know what I'm saying? Compared to other companies like countries that may regulate it. And then they just have a bad damper, like you say, on socialism. Like, oh man, that's socialist. You know, they have some of the poorest people in the country complaining about getting some of their healthcare costs and medical costs reduced. You know what I'm saying? And talking about, well, that's socialist. Well, you're not winning in the capitalist system yourself. You know what I'm saying? You can't afford it. Then you want to complain about healthcare. You know what I'm saying? But that's basically it. It's the political system we got set up. You know what I'm saying? The simple fact that pharmaceutical companies carry a big lobby in this country.
Yeah, that's pretty much what it is. It's the lobbying and it's a fear thing. And what we as American people need to do is we need to educate ourselves, and we need to start really asking, you know what is best for us, not what is best for any system. What is best for the people?
Yeah,
because capitalism is not the people. You know, we are the American people, and yes, you know, capitalism is good, but what is best for capitalism isn't always going to be best for the American people. Although I do believe in capitalism, it isn't great for everything.
Yeah, and I mean, you know, and I think we talked about that, but definitely, it's crazy. 2022, we spent $4.5 trillion in healthcare. Now that's an inflated cost after COVID came through. That's about $13,500 per person in this country. You know what I'm saying? But with that being said, we come in last in every category when it comes to wealthy countries, when it comes to healthcare. So we ain't get the bang for the buck. We paying more.
Yeah,
we're not getting what other countries are getting, and most of them are getting it because they have some kind of universal healthcare program together.
Yeah.
Go ahead.
Go ahead.
One other thing that I will say that isn't necessarily the government's fault is America is too damn sedentary. You know, so some of this is corporations, but when you look at the amount of obesity in America compared to other developed nations, and you look at the number of people who have diabetes, the number of people who have high blood pressure, the number of people who don't move and exercise, especially in the South, that kind of rolls into it. But again, that has to do with, okay, do we have proper roads? You know, we all live in the suburbs. How easy is it to get out and exercise? You got to be worrying about getting run over by a car or something.
Yeah, speaking of yourself.
I mean, some of it is like,
I'm in the hood, baby.
Some of it is also like,
hell.
Yeah, but some of it is also like, when I think about it, I think about like back to the days of the royals, and you think about a lot of kings and royal people and people with the lords and ladies. They was all big. Why? Because they was living fat. They was taking all the money. They was eating good. It was just, they had gout. They had all this disease and shit. They did from eating too much and shit. And that's where we at now. I mean, our country is just living large. We got more money than other countries out there, and we spend a lot of it on food and comfort things and shit like that. Even when we don't have a lot of money, I see a lot of motherfuckers out there that talk about they ain't got no money, but they going on vacay. You know what I'm saying? And they doing shit. So a lot of that has to do with the prosperity of the United States as well. That makes us sedentary like that and fucks up our health. But another thing I wanted to touch on with this is like the denied coverages that happens a lot with the healthcare insurance. So although millions of Americans feel like they have adequate insurance, many are surprised when they're denied coverage to that medical care. So Steve, what justification could healthcare insurers be using for denying coverage?
Okay, so if the medical paperwork isn't done properly when it's submitted to the insurance company, that's one. If it's not a necessary procedure, okay, that's another one. Lack of prior authorization. Sometimes it can also be, but a lot of these things are arbitrary. Okay.
Yeah, that's what I'm gonna say. Like, even that's their rules, but like, is it right? You know what I'm saying? If I'm paying, like you said earlier, you paying for some shit, but you ain't getting nothing out of it for what you paying. I think you talked about that with the accident or something that your mom's was in. But it's funny, like, yeah, you right. Like, they got it in their contract. You can't. It's hard to fight that shit. But why would you do that shit? Like, if you really, like you said, customer service, like they had denial, and what was it? depose, deny,
and
delay.
and delay.
Delay. That's some
Why,
bullshit.
if you're a customer service oriented company, like let's imagine if Amazon's thing was delay. Motherfucker, Amazon try to get you shit the same day if they can.
Yeah.
You know
Absolutely.
what I'm saying? Like,
Absolutely.
this is customer service, but you bringing up good reasons because that's what's in the contract. But is it right?
Oh hell no, it's not right, man. But this is what I was gonna. The problem is, again, we as Americans need to figure out a way to speak up for ourselves politically where it hurts these insurance companies, and we have not done that. Right. Even with unfortunately with the Affordable Health Care Act, Barack Obama walked in. He wanted to have a government payer option where, you know, we could buy into what the Congress and everything has. As soon as he got in them back rooms, everybody was saying no.
Mm-hmm.
Okay. We need to empower the people who want to do stuff for us.
Right.
You know, Bernie wanted to do that.
Mm-hmm.
You know, before, look, her first time she ran for president, Kamala wanted to do it. But what you will realize this. Motherfuckers get in Washington, excuse me. People get in Washington.
You can cuss on this show, man. You can cuss on this show.
But I'm trying to cut it down because you know I got a potty mouth.
Right.
People.
We know you need Jesus.
Yes, I do.
Oh, he got plenty of Jesus, but we all need him.
Yes. But people get in there. These lobbyists have too much power. And again, not just in the healthcare system, they have too much power, period.
Mm-hmm.
Okay. And because of the tribalism of our politics, it is very easy to pit things against each other and everything. And for people just not to get what they need.
Yeah.
And if we want better healthcare, then we need to hold congressmen, senators,
mm-hmm.
accountable.
Yep. Agreed.
Yeah, that's that bullshit right there, man. The games that they play not to pay us. I mean, end of the day, end of story.
Yeah.
You know, I mean,
basically
delay.
Yeah.
That's in their goddamn rule book. Like, purposely go in and delay this shit. So the people will get frustrated enough with us, hey, fuck this. I don't want to do it anymore.
Yeah.
And deny. Come up with bullshit ass reasons to deny people. That's fucking stealing. I don't care what you look at. That's, you know, in a neighborhood, if somebody borrowed $5 for you, you know what I'm saying? And hey man, I'm gonna get back to you, man. I'm gonna get back to you. They just delaying. You know what I'm saying? Yeah. They gonna have problems.
Yeah.
They definitely say, hey, you know what? I ain't gonna pay you back, man. I don't think I have a reason to pay you back.
Yeah.
Yeah.
That comes with a fight.
To your point, to your point, that's just natural. I mean, regardless if it's like you said, somebody just owes you $5. If they keep delaying, you gonna get angry. You don't think we mad at the healthcare insurance when they delaying our coverages?
Yeah. And you know, they train and reward people for that shit, is what I'm saying. That's in the fucking handbook when they train you. That's why he wrote that shit on them bullets. You know what I'm saying? Because that's their tactic. You know what I'm saying? Mm-hmm. It ain't like, you know, this is this is the standard in insurance and how they do it and why they sit number 4 on the goddamn Fortune 500. That's how they make their money.
Yeah.
Mm-hmm. By taking our money, because I always said this about insurance. They don't produce no fucking product. Mm-hmm. You know, at least like ExxonMobil has gas. You know, Amazon gets us our shit when we want it, when we need it.
Mm-hmm.
Insurance is just on a promise that when shit gets fucked up, they're gonna give us our money, and they got tactics not to give us our fucking money back.
Yeah,
that's fucked up. You know what I'm saying? And you know, and it's got to a point where a criminal, because this dude's a criminal, he walked up and shot somebody at point blank fucking range, so that's not cool. Mm-hmm. But they're celebrating the guy because that's how much they don't fucking like insurance. Yeah. And that's sad because they're the fucking criminals. Like they're legally doing it. They're doing backdoor lobbying. They're buying off fucking senators and congressmen so they can charge us the most fucking money because they don't charge that shit in Istanbul or whatever the fuck they selling their medicine. Mm-hmm. But here they're gonna charge the fuck out of us because they got to deal with the congressmen and blah 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 behind the scenes. That's fucking stealing. I hate to say it. That's what it is.
It is. And then you look at it like this: anywhere else, if you pay for a product, you're gonna get it. Yeah. You know, it's like if you say, okay, well, I'm going to buy a car and somebody says, you know what, you can't have that car because of blah, blah, blah. That's not going to be the case. You're paying for health insurance. You're paying to be able to get this service. And then when it comes time to get it, we're going to deny you. Mm-hmm. And the other issue is this: when it says something is deemed unnecessary, Well, my question becomes this: how the hell are you going to say something is unnecessary if you've already gotten the authorization and the doctor says you need it?
Yeah.
Okay.
Yeah.
And it would be one thing if they kind of like looked at it. To me, all of this stuff is too murky.
Mm-hmm.
You can't have an industry where stuff is not really on the up and up, to where a simple, well, even not even simple, because the doctors half the time don't know you're gonna get denied for something.
Mm-hmm.
Yeah.
And if the doctor doesn't know, and that's their job, well, then what are you gonna do?
Yeah, where did we come to where when it's a medical necessary shit that a fucking insurance agent gets to make that decision?
An uninformed
That's what I'm saying.
agent, you know,
That's
they're
just
not
crazy.
doctors, they don't
That's
know.
what I'm saying. We got to the point where, you know, think about it like this, man. This how fucking crazy insurance is. They get their money before you get your money. When you get paid, they cut off the top. You pay insurance off the top, you don't even see that money. And you do that for years on years and years and years on end. I hate to fucking add up the number that they getting their money off the top. When you start working, you sign up for insurance, you got to pay them straight up. You don't see that shit. But then they can turn around, and when you do get sick and when you do need them, they want to play fucking games and deny and delay and blah, 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 and all that bullshit. Of course, people going to be mad about that shit.
Yeah.
You know what I'm saying? And I hate to say it because, you know, I mean, it's just, you know, it's just sad in this country that, like, it doesn't even make sense. Like, you know, you go to the doctor says you need this, you see if your insurance is going to cover it, you call them and they come up with a reason why they can't or whatever. That's nuts.
Yeah.
Who drew that the fuck up?
Yeah.
Yeah, man. So it's hard, man, when everything is so damn complex. But what's not complex is clicking the motherfucking like button. Okay,
Please
click that like button. What are you gonna say?
We won't delay the non-disposal if you click that like.
You know,
button.
please.
You know,
you won't get delayed. I'll put your comment right on up.
Right on.
Click the like button.
Yeah.
Make sure that you subscribe to Left Wing Kings, and then of course you want to share share this content on all of your social media platforms out there. All right. So speaking of complexity, third on our list is administrative complexity. And I think it ties right into the conversation that we were just having, really. I mean, when you think about it, there's a point in time when you are paying for a service, right? But do you read through the whole contract? No. Do the insurance companies utilize things in that contract to deny your coverage, to delay your coverage? Yes. That's all part of like this administrative complexity. And also this thing that's not even in the coverage that, you know, might come up. Like for me, I tried to, like, you know, my doctor was like, hey, you used to smoke, right? So, you know, it's a chance you might have, you know, we might want to look at you for cancer. Just check and make sure you don't got lung cancer. Not that I had any symptoms or anything like that, but like, let's check on that. Well, you know, it's not in the contract that they're not going to let you take a test for lung cancer unless you smoke this many years and you smoke this many cigarettes a day and it's but that's what they ended up asking me those questions. And it was like, well, you didn't smoke enough or for long enough, so we're not going to test you for cancer, even though you might have it, right? So that's all part of this administrative thing. And the U.S. healthcare system is notoriously complicated. So there's a maze of paperwork, there's rules, contracts, bureaucracy, and all this stuff frustrates the patients and even the doctors. Like you said, a doctor might say, you need this. And then it comes back, well, nope, you can't do it. So even the doctors that are frustrated with the complexity. So Ace, is this healthcare system complexity just a means to delay more coverage, or does it serve another purpose that's reasonable?
Not a reasonable purpose. Get your pockets fatter. You know what I'm saying? That's the only thing I can see. But when I read this question, I thought about it like this. If the healthcare industry had a social media profile, its status would be it's complicated. You know what I'm saying? Like, what the hell? I'm 54. Started working, you know, I've been working close to 40 years. Who knows how long I've been paying into the healthcare industry? And I still don't know what the fuck's going on when I get my shit, when I get my insurance, when it's time to renew and all that bullshit. You know what I'm saying? All I know is it's always some bullshit rule. Like if I don't sign up by this, and I'm gonna get a more fucked up policy than I had this year. So I better go in there and look at it. But I don't understand that shit to the point where I'm comfortable. You know, some things I do know better than some things I don't. more likely I just kind of go with what's working for me right now. Let me just go sign up for it. But I don't read the fucking fine print. You know,
I don't even know if they give you fine print to read. It's
exactly.
Like you get like, here's your choices, and this is how much you're going to pay, and this is how much your out of pocket will be, and this is the coverage if it's in network and out of network. Basically, that's what you know at the time that you sign up, and that's it.
But you don't know, you know, and then they'll have some things that sound good, like, hey, you know, if you get this, you get that, you're covered or whatever. But then, like you say, you go to the doctor and find out that ain't covered. You don't find that out until they don't have that shit written down and say, if you have these things aren't going to be covered. There's going to, you know, so that's just the smoke and mirrors that they have. That I try to keep things on a common sense perspective. You know, I don't try to complicate shit. My whole idea is when you make shit complicated, that's because you don't want me to know some shit. If you don't want me to know some shit, that's because you want to find out ways to keep my money. Yeah. That's the only thing. Because in insurance, I'm giving you money with the idea and the hope that something happens to me, I'll get that money back. Right. All the shit that you promise. Hey, if you pay this, you'll get $1 million coverage on this, and that's all the shit I'm going for. What I didn't sign up for is the bullshit complex shit that I got to go through. The time I got to fucking wait. All the fucking running around I gotta fucking do to get my own fucking money back. You know what I'm saying? That's why I hate fucking banks.
Yeah.
I mean, like, go to the bank, try to get some fucking money. They arguing with you about your own goddamn money. Like, what are you talking about? Yeah. Same thing with insurance fucking companies. You know what I'm saying? At the end of the day, in the story, there should be some kind of equity in what I fucking paid in the day in the story. Like, but it ain't, because like you said, we don't go through and pull out the whole contract when it's time to re-up or open enrollment and go over everything. No, we sign it and they give us a short period of time. You got 30 days to make a decision on this. And they kind of tell us exactly everything that they want us to see.
Yep.
Then we make a decision off of that. And then when the shit really hits the fucking fan, then that's when we find out, oh shit, I'm not covered for this. I need this. I don't know about other countries, but we need supplemental fucking income for shit. Like now we insurance, we got insurance for this, but they tell us, no, you need to get some additional fucking insurance for this and that.
Right.
The fuck? You know what I'm saying? So
yeah.
And see, and that's where if we had a government option, we could have a government option. And then if you wanted something else, well, then you could get a little bit of supplemental. And at least everybody else then would have something basic. But we don't even have that. Okay. I do also think that when it comes to these things, it should be something that is simplified communication. You should be able to explain to somebody, okay, this is what you need to do, and that's it.
Yeah.
You shouldn't have to be an insurance expert to understand what you need to do to be able to get something without going through hoops.
Right.
The lack of simplified communication is an issue with insurance companies when it comes to health insurance.
Yeah, and then the hospitals blame the insurance company blames the hospital. That's shuck and jive bullshit, man.
Yeah.
And like I said, it ain't like these cats ain't making no money. $4.5 trillion. Like I said, dudes are banking and rich and living a lavish lifestyle off this shit. So that's where you can see where people have frustration because they don't see the result coming back. Like, dude, you're a fucking billionaire off this shit, a millionaire off this shit.
Yeah.
And my mom can't even get covered, and she been, paying insurance to your ass for 50 years, and she can't even get coverage because y'all done found some loophole not to fucking pay her.
Yeah.
That'll drive you wild, man.
Yeah.
Speaking of crazy.
Speaking of that takes us right into our next topic, man. The lack of access. So there's millions of Americans who are uninsured. They might be underinsured. Like you said, they need supplemental insurance. And that leads to like people not getting the care that they need, right? Either they skip medical visits or they just can't afford to go at all. I've gone to the doctor's office where I've seen people like get pulled to the side, handed a piece of paper, like you got a balance, and they got to turn around and leave because they can't pay the balance because they'll make you pay that balance before they go see you that day. You know what I'm saying? So there's a whole lot of issues with lack of access. So Steve, what factors contribute to the country with the world's largest economy having citizens with little to no access to healthcare insurance?
Right. Okay. So 8% of Americans don't have any health insurance at all.
Wow.
They don't have anything. Okay. Most people, when you do have health insurance, you're getting it from your job. So if you change jobs, then your health insurance status might change.
Yeah.
Okay. People do have Obamacare, but it's not always the cheapest option because again, even with Obamacare, you're still dealing with insurance corporations, you dealing with Humana or Cigna or whatever health insurance. And when you get these businesses in to this, it's going to cost more money. So a lot of people can't afford it.
Right.
Mhm.
Okay. And Medicare, Medicaid, those types of things aren't available to everybody. So you have a number of people who they don't have enough money.
Yeah.
And in turn, what happens is this: when you don't have enough money to get proper health care, you don't go to the doctor until you get very sick.
Mhm.
And then when you get very sick, then whatever procedures you need are going to be much more expensive because you're more ill.
Yeah.
Mhm.
Well, see, but then a lot of times, even with that, it's like, if you don't have insurance, they can't deny it. But what happens is this: because it's deemed, medically necessary for you to live, then the hospital might do it, but then you're left with these huge medical bills.
Yep.
Mhm.
Okay. So we as a society are going to have to look at, okay, when you talk about life, liberty, and the pursuit of happiness, let's be real. Healthcare is under all three of those. Life, if you don't have good healthcare, you ain't gonna have no life. Okay.
Mhm.
Liberty, if you don't have good healthcare, how are you going to ensure your own freedom if you can't get out of damn bed? If you can't walk properly. Okay. The pursuit of happiness, your happiness depends on you being well. Okay. So having good healthcare is as American as anything. It's American as Uncle Sam. It's American as apple pie. It's America as the San Antonio Spurs. Okay.
Yeah. Oh my God.
Shout out to them Spurs, baby.
I'm gonna leave that alone.
Yeah. Yeah, no, crazy stuff, man, that we're talking about here when it comes to it. A point I want to make out, man, when I was doing some research, I looked at the Fortune 500. 4 of the companies, the top 10 are healthcare companies. It's a United Healthcare, which is number 4, and not in any particular order. It's CVS, Concora. I don't even know who the fuck they are. You know what I'm saying? But they're in the top 10. And McKesson, and McKesson had a lot to do with the vaccines and stuff like that when it was coming out. So those are 4 out of the top 10 big time corporations we have in this country tied directly to healthcare. You know what I'm saying? But then, like you said, most people, probably everybody in this room, got a goddamn horrible healthcare story or something where it's denied or delayed, or I couldn't get this, or I couldn't get covered with that, or whatever. Or I didn't have insurance at the time and I had to pay out of pocket. And that's another thing. We get hit over the head when it comes out of pocket costs.
Oh yeah.
No mercy in the United States when it comes out of pocket costs. It's just what it is. If you ain't got no money, you got to pay out of pocket. That's a horror fucking story for itself right there. So
yeah. I mean, I think what you just said, reminds me of like our economy is so good. We're supposed to be the land of milk and honey. You know what I'm saying? And we got people who can't even like get the basic healthcare needs taken care of through insurance, that they have to pay out of their own pocket. They have a lack of access, whether it's because, like you said, maybe not even somebody who's like, maybe they don't work for a corporation, but maybe they're an entrepreneur. What their healthcare look like, I don't know. Maybe they got it, and maybe it's expensive as fuck, or maybe they trying to save money because they live in paycheck to paycheck. Their business ain't doing so well, so they don't have any healthcare insurance. They're taking that risk. You know what I'm saying? 8% of people, that's a lot. 8% in America. Million. 26 million people, yo. That's a lot. Like we talk about, there's so many industries out there. The healthcare, not healthcare, the beauty industry. You got people who work as like service people, like barbers, hairdressers, nail stylists, nail polish people. I don't know what they call this shit. Pedicurists, I don't know shit. Manicurists. They usually don't have like they don't work a nail tech. Thank you. Like they don't like. I'm making up shit.
Pedicurists, boy.
Nail fondlers. We got nail fondlers. They be fondling your nails and shit. But these people, like, they don't work for like companies that usually provide healthcare to them.
No,
They got to get that shit on their own, right? And a lot of them, like you said, Steve, they may not be making enough money to get that coverage. So now they have no access and they got to pay out of pocket. You see, these are the people who you see, and it, no disrespect to anybody. I'm just telling you, like, that might be like going to Texas Med Clinic as that's their first option.
yeah, or I'm gonna say the emergency room.
Yeah, or emergency room. That's their first option.
Emergency room is the highest shit in the insurance.
Yeah.
You know
Exactly. But if they don't have, they know they can't go to schedule a doctor's appointment with Dr. So-and-so and have a primary care physician and shit like that. They don't have that.
Insurance.
Yeah.
Yeah.
Yeah, well, insurance is gonna cover you. That's the first thing they're gonna say. You know what I'm saying?
Yeah. And a lot of those people you're talking about, they might have insurance, but they will be underinsured. They'll just have the bare minimum. You know? And what happens with that is it's still the same thing, just like if you don't have insurance. If you got bare minimum insurance and it don't cover shit, well, then you're not gonna go to the doctor until shit is out of hand.
Yeah.
So it's not helpful if you're not giving people basic, look, you got to be able to make sure that people can get the basics,
Yes, sir.
You got to make sure that people have an opportunity to catch things before they get too bad. You got folks with diabetes and everything. They don't go to the doctor and stuff until their leg is, all gangrene and everything. They need their foot cut off and stuff like that. And
just
this
walking around dizzy for no damn reason.
Yeah. And these
eyesight getting fucked up.
Yeah. And these are things, it hurts everybody because
I think you made a great point about our politicians, like their responsibility with this, right?
Yeah. But like I said, we got to get past our tribalism. It's not a Democrat thing. It's not a Republican thing. Mm-mm. You as a person, you should be able to go to the damn doctor and make sure you're all right.
Basic need, man.
And real talk, you should be okay with your neighbor making sure that they're all right too, if they ain't in the same financial situation as you. We as Americans need to be more communal and look out for each other.
Well, why you think like places like Canada, they just roll into the doctor's office, get their treatment, whatever they need, and roll out? Because Canada, like you said, they care more about the community and the individual than we do. And when people say stuff like, and I heard you bring this up earlier, like people are afraid of socialism. Do you know how many social programs the United States already has that are socialistic?
Yeah.
Social Security. It's called fucking Social Security.
Yes.
Yeah.
Okay. Education.
Yes.
That's social. I mean, we already have all of these things that are socialist, but we still use that and everybody's taking advantage of it. And like some people are like, I'm not going to public education. Fuck that. Some people got money, so they go to private education or they go to a charter school or whatever because they have their other reasons. But the majority of people are using all of these socialist programs to help them. But then at the same time, politicians are using socialism as a means to scare people away from shit.
Yeah. And I got this. Imagine this, okay? If you had to freaking pay every month into the fire department, okay? Because we didn't have just San Antonio Fire Department that covers everybody or Bexar County Fire Department that covers everybody, okay? You had to pay for a fire department in case there was a fire. And if you opted out of it, they wasn't going to put your shit out.
Like fire insurance.
Yes.
You know what I'm saying? For the firemen to come
all of these things, just like you said, to piggyback on what you said, the police department, all that shit is covered.
Social.
It's all social.
Did you pay your police bill?
Yeah. You know what I'm saying?
We got public libraries.
You just get robbed, fool. We ain't coming out there.
Public libraries. All of that. It's all socialist. All of socialism.
Lose our number. Your bill is undue. We're not coming out there, bro.
So we need to look at, and there are things, like I said, I've said it and I'm going to say it one more time. There are things that should not be for profit. My wellness, your wellness should not be for profit. People out there, your wellness should not be for profit. Okay. Now I'm okay with doctors making good money and everything, but I'm not okay with these insurance companies and these hospitals, the CEOs making $40-50 million off of people being sick.
Yeah.
They got homes in the Cayman Islands and shit. You know what I'm saying?
Yeah.
Selling a product that they didn't even have to build. You know what I'm saying? They just have to, sign you up and then fuck you out your money, plain and simple. I mean, that's just a good way to say it. When I was looking this up also, I saw a lot of people, some people saying, hey, you know, well, in Canada, you go to the doctor, it's going to take you 5 or 6 hours and blah, blah, blah. Well, you know what? We got a hospital down here that they pretty much provide you a health care. If you go there, yeah, it's going to take a while getting there. You know what I'm saying? It's going to, it's take a minute, be all day if you go down there. So, like, nah, man. I mean, you know what I'm saying? Like, of course, if we had a way of having healthcare where everybody can be covered, of course, you can have places that are going to be fuller with people that probably don't have access or don't have better insurance, but at least they're covered. Now, if you probably have money and access, you can probably go to a better doctor. That's like anywhere else, you know. So when people hear us talk about Canada and some of these places that got universal health care, they want to say, well, over there it took you so long to see a doctor or whatever. Yeah, same thing here. You got the same thing, you know, because we do have some places of free clinics, and they do try to provide basic services. And most of the time, those places are real crowded with the people who are uninsured, the 26 million that you're talking about. So it's a longer wait, you know, basically, because that's what it is.
And you know what, man, to that point, it's funny, man, what people value in this life, man, because a motherfucker will stand in line for 6 hours for a fucking iPhone.
Yeah.
But they want to complain that it take 5 hours to get your fucking heart checked and shit. You know what I'm saying?
Yeah.
The simple shit, like people put their value and their priorities on such different that the scope of that shit is just wow, man. But you know, part of this whole thing that, you know, really gets people pissed off about the American healthcare system is that even though they're paying so much money, their health still sucks. And our life expectancy is just so low. So that's our last topic is poor health outcomes. So like I was saying, despite the high cost of the healthcare insurance industry, we as a country, the United States lags behind other developed countries in metrics like life expectancy and preventable deaths. So Ace, if we spend the most for healthcare, why don't we have the healthiest citizens?
First and foremost, America, out of the top 10 wealthiest nations, comes in dead last. We're number 10. You know what I'm saying?
Life expectancy or death or what?
That's overall. You know what I'm saying? That's including life expectancy,
quality of life,
preventable deaths, pandemic deaths, and a lot of that because we have an opioid epidemic.
But we number one,
and we also have gun violence. We're number one in gun violence. That plays a role into it also.
Definitely.
Average American spends 18% of his check on healthcare. That's a lot. That's 20% damn near. You know what I'm saying? Like that's what you spend on healthcare. Like I said, they get their money before get us. They got a 20% cut.
1/5 of your check is.
You know what I'm saying? We pay about $5,000 more than all these other nations. A lot of those other nations don't pay as much because they have universal health care. They have something in place for that. Steve hit it on the nail in the head. You know, we eat out. We eat McDonald's also. We don't live a healthy lifestyle. We're gluttonous. We're like the Romans, baby. You know what I'm saying? We sit there and they feeding us grapes and we eating them. We fat and happy. You know what I'm saying?
Yeah, our grapes are bonbons.
Yeah, man. Whatever. I just ate apple fritter this morning. You know what I'm saying? Like, for real. Like, I'm not one to talk. You know what I'm saying? I just enjoyed myself and got enough nerve to drink a Celsius behind it. Yeah. You know what I'm saying? Yeah, I'm that nigga.
At least you doing work. At least you doing right.
I'm that nigga that orders the double cheeseburger with a Coke Zero. That's me, nigga. Like I'm saying, gotta watch my sugar. You know what I'm saying? But you know, trying. That's all that matters. Supersize that shit. I need the big order of fries. That shit.
Hey, as long as you trying, that's what matters.
That's American. You know what I'm saying? Hey, look at it. I don't have any, you know, I am proud to be an American. I am proud and I am thankful that I live in a country where I have that choice. There's some people right now that, you know what I'm saying, that, you know, they eating dirty apples off the road or whatever the fuck. They trying to make it happen. Some countries, you can't. I remember somebody came here and I've either heard it in a comedy skit or I've talked to some people also. But we can eat 24 hours a day. Anytime. We know we can get food. There's some countries you can't get food after a certain hour. That's it. If you ain't got it at home, you ain't eating. So we can wake up middle of the night, 3 o'clock, take our fat ass to a convenience store and get a bag of chips.
Or pick up this phone and DoorDash. Uber Eats.
But the cost of that is our health is horrible because of that.
Yes, sir.
And because of that, like you said, we don't exercise. We smoke fat cigars. I'm a cigar smoker. We We don't always do the thing, you know. I like to drink my alcoholic beverages. So we have a lifestyle that contributes also to our healthcare problem.
Yeah.
But with that being said, we pay a shitload of money that other countries don't have to pay for it.
Yep.
Without the results.
Yes.
And it comes to it falls back onto our political system. Straight up, we got these people that are being lobbied by the medical industry to keep us fat and happy and keep us unhealthy. Hey, look, it ain't no profit in the cure. We know that.
Right.
They don't want to cure diabetes. They don't want to cure cancer.
Right.
But they want to charge us a shitload of money to remain sick. You know what I'm saying?
Yeah.
That's crazy. You know what I'm saying? They don't want to cure the opioid problem. So I ain't say that shit. I seen dope sick like everybody else.
Yeah.
They knew the shit was addictive.
Mm-hmm.
And they told the doctors and the salesmen to push that shit anyway.
Yeah.
You know what I'm saying? It's dudes I got in prison right now. Been in prison for a long time for pushing shit that made people feel good. You know what I'm saying?
Mm-hmm.
And these dudes did it legally.
Yeah.
You know, all that shit. You know what I'm saying? So that's why I call them what they are. They're fucking criminals. You know what I'm saying? You locking us up, giving people 25 to fucking life for selling drugs, getting people addicted. You doing the same fucking thing just legally.
Yep.
You know what I'm saying? And it's way more fucking lucrative. You know what I'm saying? Nobody's ever said when they say a fentanyl problem or whoever fucking makes fentanyl, why don't we just go shut them down? That's never been a solution. They blame Mexico for bringing it. What do you mean? Blame Mexico. What about the fucking people making fentanyl? Have y'all called them and told them to stop making that shit? How about that one? First and foremost.
Yeah.
Because Mexico wouldn't be. And then they gave the fucking recipe to these motherfuckers. So now they making it on their own.
Mm-hmm.
Yeah.
So come on, bro. You know what I'm saying? Pharmaceutical company. I always say big pharma. The health, all that shit. That's a criminal fucking enterprise. Scarface said it best. He said CVS is on every fucking corner store. On every fucking corner. They the fucking drug man.
Yeah.
You know what I'm saying?
Yeah.
They the dope man now. They pushing the biggest dope in the city. They got a CVS on every fucking corner. You know what I'm saying?
Yeah. So what you're saying basically is that we're making, they're making profits off of our sickness. Okay. So I think that this is what should be happening. I think that they should be rewarded for solutions, for cures, instead of being rewarded for fixing side effects. I think that would be helpful. Okay. One of the other problems that we have in our healthcare system, why so many people get sick, when you look at rural America, okay, you live in Flatonia and Gonzales or somewhere like that, there's not a closed trauma center. Okay. And and this happens all over America where you have places where you're not really close to a doctor. These rural hospitals have been closing down because these people, unfortunately, they don't vote in their best interest. They vote for people who are backed by these corporations, and they'll say, well, that's not our problem. Okay. Also, when you look at the rate of cancer and the rate of birth defects and everything on Cancer Road, so when you're talking about from Houston all the way to, I think it's Biloxi, where all the refineries and everything are. Okay. When you have situations like that where people are getting cancer and birth defects at such a high rate, that is a health issue. But instead of us addressing those things, it gets slid under the rug under the guise of freedom. But again, if you sick, you ain't really that free.
Right. Yeah.
Not at all. Yeah.
I think that what you brought up too is a great point about like coming up with cures and I guess like awarding or rewarding the people or company that come up with those cures, preventative measures. One of the things that our company does, me and Tina, is like there's a program that basically if you preventing things, like taking steps like you working out every day and like it'll track it through your Fitbit or your watch or your Apple Watch or whatever. If you working out a certain amount of hours a week and shit, then you build up points. And as you build up points for different activities, even watching videos about how to eat healthy or, how to stay calm, it's a whole program full of shit. But basically, the more that you do, you reach certain tiers. In each tier, you get a discount on your medical coverage for the year. So like if you get all the way to the top, I think it's like, I don't know, a few $1,000s that you get off of your medical costs, like for the year. So promoting that type of healthy lifestyle through rewards like lower healthcare insurance. The government can get involved with some shit like that. I mean, now it'll take some time to like have a website set up, and there might be a lot of traffic and shit on it. But hey, if you can prove that you're doing these steps, a lot of healthcare companies don't have that type of shit. But healthcare companies should like that, because if you're healthier, guess what? You're gonna cost less. Your expense will be lower. You're not gonna have to get coverage for this, that, and the other. And they don't have to deny your fucking claims because you're being proactive in having a healthy lifestyle, so you don't have to go to the doctor as much. So I think that's an important part too.
Yeah, I mean, and the day in the story that they still get paid. I think our company has something like that. There's an incentive program to where, if you're living a healthy lifestyle, they give you so many points off your insurance, so so those are good programs. But in the day in the story, healthcare is crazy and it's complicated in this country. It's been an overall situation forever, ever since I've been coming up and voting or whatever.
It ain't going nowhere.
Been something on the platform, and we'll have this set of politicians come in and lie to us. We'll have another set of politicians come in and lie to us, and like you said, they go in the back room because we don't have access to those back rooms. But these big insurance companies and the dudes that really pulling the strings are sitting in there, and they making these men rich on top of what they're already making. And at the end, the American people lose. It has nothing to do with blue or red. It has nothing to do with anything. It's got to do with the simple fact that I always said this: it's a class thing. If you're not in the right class, this last election should have proved that. You know what I'm saying? We voted for class. People think it's other things, but no, that's what it is. Certain class of people are going to benefit on who's in office now. The majority of the people, and what's sad is the majority of people who voted for him ain't in that class. You know what I'm saying? And that's what we're talking about, healthcare. You probably got healthcare problems. You probably ain't in the class. You know what I'm saying? You're not good. You know what I'm saying? So that's what we're talking about when we're talking about healthcare and how it benefits you as a citizen in this country.
Yeah, I think that kind of closing this out is like we wish we could come up with some solutions for all of these problems. But to the point you just made, it's how our society is. It's a societal issue, and the norms that we have right now that through capitalism or through like the lack of political intent to change things, they want to keep things the way that they are. It's going to be really hard to come up with the solutions for a lot of this without having some negative impacts downstream. Like if you, let's say, to me, I think like, and I don't remember what the name of it is or whatever, but most of our U.S. politicians all have free healthcare for life.
For life.
Once they become a politician, like they could leave after 2 years, nigga, you still got it. Like why you get this like free healthcare that you can have? If it's good enough for you, it should be good enough for everybody.
Exactly.
Now, what happens though if you do that? There's a lot of the top. You just named some companies that are the top 10 in the country tied to medicine. Them companies ain't gonna like that too much, and they're not gonna have a good day. They're gonna lose a lot of fucking money, and that could negatively impact our economy. So there's a lot of give and take that has to be thought through, and you have to be very purposeful when you think about how to solve to these things, and think about all of the downstream impacts, that the likelihood of those things happening and the consequences of those things happening as well, because we don't know. At least at this table, I don't think I know. I'm not going to speak for y'all, but I don't know what all of those impacts are, but they should have insight into it. But once again, to your point earlier, they need to have transparency. If they're not going to give us the best of the best and do for us, explain to us why, so we understand why we're getting fucked. You know?
Yeah, no, that's true. That's true. And it's crazy. We got to think about the moral complexity of that, how the conflicting moral issue of that. You sitting up here, you got free healthcare, you good.
Yeah.
You voting on shit to make sure that people don't have free fucking healthcare, and they're struggling. Then sitting in their face and fucking lying to them, talking about you for the people. You a fucking lie. You got free healthcare.
Yeah.
You good. That's what you voting. You voting to make sure that you good. That's what you're doing. But you sit there and tell people you for the people, and that's the smoke and mirrors.
Yeah.
That the majority of the American people let these politicians paint on. Dude, they're not looking out for your best interest.
Nope.
They're absolutely.
They tell them when they say cutting taxes, they ain't talking about your taxes. They're talking about their taxes. You know what I'm saying? Because you ain't in that tax bracket. You know what I'm saying? So healthcare falls into that extreme also, where you say a lot of people vote against their interests, not understanding it. Because like I said, once again, I've been working for over 40 years, and I still don't understand what the fucking healthcare problem. You know, on a bare minimum, probably what I should know about healthcare is what I know, like kind of what it's gonna cover, what I'm gonna pay, and what it's supposed to do. But when it gets down to the nuts and bolts in it, I don't fucking. It's a crapshoot. I hope, God bless me to where I ain't had any serious issues where I had to find out. But there's a lot of people that did, and they always run it. I've always heard horror stories. I've never heard anybody say, "Man, that was great," and they did this and that. I've never heard that story. I always hear a horror story. Yeah, I'm saying so.
Well, let's go ahead and jump into some of these comments, man. And if you guys feel the need to call us and have a conversation, you can call into the show at 210-728-6581. That's 210-728-6581. All right. Yes. So let's jump into the comments. First and foremost, we got Tina Booker. Who is that? She said, insurance companies ask the likelihood of a person dying as a reason to deny a test or a specific treatment. What are y'all's thoughts on that?
It happens, but again, it's just like H just said about how can you morally say that that's okay? You know, that's, whether it's legal or not illegal, it's definitely immoral. Now, unless somebody is just on their deathbed, if they're in hospice and everything, and then they want to run some tests, that's different, because then maybe it isn't, then maybe you could say that. But I feel like if somebody has any type of shot, even if it's remote, run them tests. Let's figure it out. Let's figure out if they have a shot at all. Yeah. So, and again, I think all of us at one point or another, we've known somebody who, everybody knows somebody who's been critically ill. You don't want to have to think about those type of things when you're freaking dealing with a loved one and their stuff is life or death.
No, not at all.
Yeah, insurance is supposed to provide some type of security when it comes to that. When the going gets tough, man, I got insurance. I'm good. It should provide that safe place. I don't think it does. And that's where the problem is in this country. It's too many people where you're thinking I'm safe, I'm good, I got insurance. Hell, Denzel's best movie is over that shit, ain't it, John Q? One of them, to where he thought he had insurance, he was working and had to go cuss everybody out in the hospital because his son wasn't covered. Yeah, it's that safe place that insurance paints for us when we're doing open enrollment, that we find out when the shit hits the fan, it ain't there. Yeah. And that's a fucked up feeling, man. And that'll drive people to some evil shit. You know what I'm saying? I just hate to say it. Yeah. We saw the movie John Q. Yeah. That was a true fucking story.
Yeah. So we also got Lynn on here. So Lynn said, one of my clients was denied care because they felt she was too old. The representative says she's 85 years old and won't be here for very long, not taking into consideration her holistic status. That's fucking crazy.
Yeah. And just because somebody's 85, people live.
Talk about ageism. Niggas.
Yeah. And shit, you never know how long somebody is going to live. That shouldn't be the only factor, And again, if somebody has an opportunity, a possibility of living, let them have that test. And at some point, we have to, I'm going to say it again. We have to be more communal. We have to look out for each other. Yeah. Money at the end of the day is great, but money is not as good as health. Money is not as good as having your mother, your father, your sister, your brother alive and well next to you.
Yes, sir.
If your child is sick, you ain't going to give a shit about how much money you have to pay to get your child well.
Yeah.
Yeah, that money don't go with you when you die.
Exactly.
And here's the fucked up part about that. What about when you turn 85?
Right.
Okay. Do you want somebody making that decision on your ass like that? Oh man, shit, you're 85, man. Shit, you almost
guess
out
what?
here,
They
man.
will.
You're almost out here, baby. I mean, we treat you, man, but shit, you got like 10 years, maybe at the most. I mean, if you're lucky, you got 10 years.
What kind of had a good life?
Yeah. Like who, like what would a figure, what would be comfortable with that coming out your mouth? You know what I'm saying? Like, and that's what I'm saying, man. That's how crazy this thing's become to where we can look. Insurance companies got us looking at the point where, oh man, well shit, you're 85. There's a number. They've dollarized healthcare and they put a number on like, well, I don't know, we'll give you that test because you're 85 years old. Shit, we hope you got 5 years left. You know what I'm saying? Like, what the fuck?
Yeah. So Tina brought up another point here that I think is important for us to talk about too, is that outside of the fact that the healthcare insurance is what it is, we're also short-staffed with medical professionals for the first time in 60 years. So I mean, people don't want to be in the profession. Is it because of the fact that they have to like give these people this horrible news and like tell them that they're not gonna get coverage, you gonna die? Because I mean, what's driving that?
Yeah. I mean, I don't know. I mean, I was never one for the medical field. I can't even, that's just never been one of my skill sets. But
could be a contributing factor, like this horrible healthcare. I don't know.
Could be. I mean, it more than likely. I mean, it's tough. I mean, I know a lot of people. My sister went into nursing. She started off. She was a hospice nurse. That was tough. Was it? She started off in the hospice care. And I remember she used to riding, and pretty much she's caring for people on their last days. That's a hard job, man.
It is a hard job.
I'm saying so. I mean, and on top of it, it's bullshit surrounding it. You know what I'm saying? Or you got to have stories about people being denied. It's still human. It's still people. That's got to be emotionally draining to do a job like that.
Yeah.
And long-term care, that's a place where like a lot of people don't even they don't understand that that's another type of insurance that you got to get outside of your healthcare. Healthcare insurance ain't likely to pay for your hospice care. Yeah. You got to have insurance for that. So
and if you don't, it's problems. I mean, like, look, I remember Tina's brother passed away a few years ago, and me and Tina was arguing with the people to try to make sure that he got a bed at a hospice facility because he didn't have proper coverage. You do not want to have to do that, man. And that should not going through that. And I mean, it wasn't we was close, but that wasn't my brother, but that was her brother. That was one of the most infuriating experiences that I've ever experienced in my life. You have somebody who is in pain, who's dying, and they're like having to think about, well, damn, where am I going to go?
Yeah.
And at times, they didn't have anywhere for him. So he had to go back to his apartment. So I'm sitting at his fucking apartment, taking care of this dude. He's in excruciating pain. People should not have to live like that.
Yeah.
And the problem with our society, again, is you think it's never going to be you until it is you.
That's right. Yeah. And that's the thing about insurance. I think you touched on this earlier, Ace, is like, it's a promise to pay for something. And I will tell you like this. I'm glad I got insurance. I got long-term care insurance. I got insurance for that shit. But at the end of the day, like, I expect these motherfuckers to pay.
Yeah.
Right. If I got it, you gonna pay for this shit because I've been paying you for X amount of years. And now you need to pay out on the promise that you provided. And I will tell you like this too. I'd rather have insurance than not have it. Yeah. I don't want to be that one guy. Like, I'm not gonna have insurance because they fucked me in that A and all of this shit. Nah, that ain't me. I'm still gonna have it.
Oh, you gotta have it.
And yeah, you know what I'm saying? You gotta have it. But at the end of the day, because we don't understand, it's so complex, there's a chance that you might not get what you paid for or what you think you're paying for.
Yeah.
Because if you ask an insurance company, they're going to tell you, well, if we cover that, then your price has to go up because your risk is elevated. Yeah. So your price should go up because of that risk. So they will tell you, they will try to justify, well, you're paying less because you're not getting that extra coverage. You know what I'm saying? But who the fuck cares about that shit? Like you said, when you think it wasn't gonna be you, and now it is you. You ain't thinking about. But a lot of people do think about, I don't need that coverage. Like some people will get a car. Let's say they just get liability because they own the car, but it might be a newer car or some shit. Well, that's your choice. That's your prerogative. But if you cause an accident, now guess what? You're gonna pay for that other person's car, but not your own. Now you got to buy a brand new car again because you don't have collision coverage for your own car, right? So there's risk involved. Like if you decide not to pay, but that's on your own decision. If it's not your own decision and you paying and you think you're getting coverage for something, you should get covered. That's me. That's what I think. Lynn's on here. She said, there are also low income individuals who can't afford insurance and purposefully get injured on a job so their job is going to pay and send them to get care. So workers' comp, like people using workers' comp, getting injured at work or saying it happened at work to get coverage.
Yeah. I know that's true in a lot of industrial situations, you know what I'm saying?
Yep.
Definitely. But
I'm coughing. That was caused by work. That's fumes. Nigga, you got the vid.
You got them on the smoke break. You keep taking. They take 85 smoke break. Got enough nerve to do that. You know what I'm saying? So
Inhaling fumes.
So you know, people do it to themselves, and when we paint insurance as the common enemy, we could do that. I mean, they got their corners, but sometimes it is just, you know, people make mistakes. They don't get enough coverage or whatever the case may be, or
they can't afford it,
or they're doing things like, you know what I'm saying, like you say, you smoking or whatever, and then, you know, you're causing yourself to have bad health or whatever the case may be. A lot of, you know, eating bad, whatever, you know what I'm saying? Sometimes you got to take the responsibility on what you're doing to yourself also. Sir. So, I mean,
true that.
As we're talking about insurance companies, which we can do that all day long because we know Satan runs all the insurance companies along with Walmart. You know, Walmart's number one in the fucking Fortune 500. Fucking devil, man, I tell you.
Yeah.
You know what I'm saying? The number one.
That's why I don't shop there no more.
Yeah. And then it's the insurance company. I'm telling you. So,
oh my Lord.
But definitely we got to take some responsibility on what we do also.
Yeah. All right, last comment on here that we got is from Tina. She just brings up an interesting fact that the craziest thing, we're supposed to pay for healthcare insurance making $725 an hour. So there's people out there, man, that, to her point, they ain't gonna make that. They ain't gonna make that call. They'll be like, I remember, man. And it's just, this ain't about insurance, but it's, to me, it just stood out to me when this shit happened. That when I was a manager, I had a team of people on the phones, right? And one of them got their house broken into, got robbed, all the shit taken, like damn near all of her shit, right? You know, important shit, TV, computer, shit like that. And she was just like devastated by the whole thing, man. And you know, she should have felt violated. Like somebody came in my house and just took my shit and blah, blah, blah. And you could tell that she was broke up about it. Like her son's stuff, like she had a kid that had things that he liked and they took all of that shit and all kind of shit. She was mad. It hurt. And then I just asked her, you know, so I assume you didn't have like security system or anything like that. She was like, no, I didn't. I said, are you going to get one? She said, no, I can't afford to. And I just thought at that moment, I was like, you are so devastated by what just happened to you. All your shit got taken, like thousands of dollars worth of stuff, right? That you paid and you worked hard for and all of this. But you can't, and I won't, you can't pay maybe $200 installation fee and then $35 a month in order to protect your stuff moving forward. You're willing to take that risk, even though this shit just happened to you. You know you can mitigate that risk by getting an alarm system, right? Like, but she couldn't afford to do it, even though she was so like devastated by what had just happened. And that really hit me when that happened. I was like, man, our country ain't in good shape, nigga. We can't even like do the simplest shit, even when something bad. And I'm working at US. I mean, you know where I work at. Yeah. I'm working, and then people tell me they can't afford that.
Yeah.
I'm like, shit.
Yeah, no,
you know,
it's crazy. And you know, and you push that on health insurance. People make those life choices. I can't afford it. Or they'll get a lower coverage, and they have complications when it comes to health. I got a friend of mine for years, entrepreneur, doing his own thing. And I was saying, dude, you got to have an answer for health insurance. He was a young man, so he wasn't worried about it when he was young. He turned that corner at 35, had to start going to the doctor, and had to start paying out of pocket. And guess what? He went and got a job to where he got insurance now. It became a priority.
Yeah.
But I told him, I said, dude, because I'm well older than him. I said, bro, it's gonna come a day you got to go to the doctor. Yeah, when you're 20 something, you can play that game. You know what I'm saying? Maybe if you're in good health, you can play the, hey, I don't have to go to the doctor. You only got to go once a year or whenever. Not even once a year. You probably just go when you're sick. You know what I'm saying? You start hitting 35, your bones start creaking, and your blood pressure starts getting exposed.
That hypertension kicking in.
Yeah, you got to go to the doctor and get some medication. And he had to pay out of pocket a few times and learn that lesson.
Yeah.
So yeah. And that's how important health insurance and medical insurance is in this country. And we're being taken advantage of. And that's the sad part about it. I don't care how you look at it. We're taken advantage of for a necessity.
Yep.
It's like if we went to the grocery store and there was another dude, off-brand dude there that told us, hey, man, to get into the goddamn grocery store, I'm going to charge you $50 every time you come in. That's the insurance company. You know what I'm saying? Because they don't make or sell groceries, not farmers. They don't own the store. But they outside and they just getting they cut before you can even get in and get your cut. And that's basically kind of where they stand.
Yeah.
You know what I'm saying?
Yeah.
Yeah, man. You got anything to add, Steve, before we cut out of here?
No, I'm good. I just want to say that we really have to look at as a whole what this does to our society. People who get sick, we talk about what it's going to cost in the long run and everything. If you get sick, you can't go to work. If somebody is deathly ill with, then somebody has to stay home and take care of them. Okay. If somebody is ill with, then that means that they can't make a car note. That means that they can't pay mortgages. So in the end, however we want to look at it, yeah, it might cost money for us to do more, but it's costing us that money anyway.
Yep. Yes, sir. Hey, man, I want to thank everybody out there on Facebook and YouTube for hanging out with us today. Appreciate all the comments. We got Lynn on here. Of course, Tina, our homegirl right here in studio with us, hitting us up with the comments as well, added to the convo. If you're not subscribed to the channel, make sure that you subscribe to Left Wing King so that you know when we are going live every week, and you can check out our videos on our YouTube channel and on our Facebook page. Make sure you follow us on Facebook, Instagram, TikTok, all of that noise. So, Ace, thanks so much for bringing all the content and the knowledge to the conversation today. Appreciate you, my king. Steve, my king, thank you, sir, for bringing all the knowledge and all the professionalism as usual. And Tina, thank you so much for holding us down on the timing in the comments and doing your thing over there. We shall talk to you guys again next week.
Left Wing Kings. Listen, think, act, repeat.